Senator Lankford.
Thank you. I want to pick up on what Senator Reid was talking about there as well. Talk me through the balance between a mosquito-borne virus and our aggressive pursuit of putting down the population of that mosquito versus getting a vaccine ready, done, produced, and out. Walk me through the balance there of how you're trying to attack that.
It's all of the above. A vaccine isn't going to be here for some time, and so right now we need to do as well as we can to reduce mosquito populations and reduce the risk to pregnant women. If a vaccine that's safe and effective becomes available, that will greatly simplify our effort, and then it will be a different type of approach. But the mosquito control activities will benefit not just Zika, but also dengue, chikungunya, and if we do them better in areas of the world where malaria is spreading, will help our malaria control activities as well.
So is the assumption both domestically and internationally, step one of this is not only development of a vaccine, but aggressive population control of that mosquito?
Correct.
Yeah. They really go hand in hand. We get asked this all the time. The thing that you could do immediately now is to accelerate the vector control and to try. It's not going to be easy because this is a very wily mosquito, the Aedes aegypti. But that is the thing that can be immediately done now as we're working our way towards developing a vaccine.
Okay, then walk me through when we get to vaccine, because when you talk about, it sounded like you anticipate having a vaccine at least done that works in the laboratory by the end of this year. Is that correct?
What I said is that by the end of 2016, we will have a trial that will have been completed that will ask, is it safe and does it induce a response that you would predict would be protective? There's a far leap from that to having an effective vaccine, but that first stage is one that we are accelerating, and we will likely have it finished by 2016.
So at this point, is it harder on that vaccine as far as dealing with the virus that we have? Is it harder or easier or about the same? Or talk me through the complications of this versus a flu vaccine.
Well, flu is entirely different, but I'll try to be brief in explaining. We have made successful vaccines against other flaviviruses.
Right.
So Zika is a flavivirus. We have a successful vaccine against yellow fever. We have a successful vaccine. We can do a little better, but it's reasonably successful against dengue. And we would have had a successful vaccine against West Nile because we couldn't get it advanced because companies did not want to partner with us. Influenza is an entirely different situation because influenza changes and drifts a bit generally from season to season. So the efficacy of an influenza vaccine, we have influenza vaccines.
Right.
Sometimes they're not as effective as we'd like them to be.
This year's been good. Last year, not so much. But
right, not so much last year, correct. This year, better.
Okay, so then the hope is to have this and then to try to distribute this internationally first, domestically, as far as let's take this out 2 years from now. Let's say it's still moving at some point. Obviously, we've got to deal with the source area in South America, but we're also dealing with Americans here.
Okay, so again, just to give you a potential scenario, you want to target the areas where you have an outbreak.
Right.
In the United States, we don't anticipate, although we are ready for everything and we never say never or never say always, we don't anticipate a massive outbreak like we're seeing in Brazil. We do anticipate that it is likely we'll see those mini little local transmissions that we did see with dengue and that we did see with chikungunya in the southeast part of the country. So unless something radically changes, I don't see broad vaccination of the entire U.S. population.
Would that include Puerto Rico?
Puerto Rico is a different story. As Dr. Frieden said very clearly, Puerto Rico is much of a different story than the continental United States because of the special conditions and to see how rapidly chikungunya spread throughout Puerto Rico. That's the thing we're concerned about with regard to Zika.
Any talk about limiting movement of people or travel from South America or Puerto Rico into the continental United States where you're seeing outbreaks start? Is there conversation about that, or is there a threshold you would say when it reaches this point, we may want to do more than just say, be aware as a travel advisory, but to say no?
There are more than 40 million trips a year from
Correct,
the U.S.
a lot. Right.
So I think that our focus now is to provide the emphasis on reducing risk to pregnant women by advising them to defer travel if possible.
Okay, and then just a quick question on this. We're talking about emergency appropriations at this point and conversation about that. At what point do you think that you would make a request and to say, we're the United States of America. We deal with emergencies worldwide all the time. We should have a fund set aside that's appropriated dollars to say we know we're going to have hurricanes and tornadoes and earthquakes. We also know that we're going to have global issues like this with health, that we would have a part of an appropriations request dealing with an emergency fund.
We would certainly be eager to follow up with you on that concept.
Okay.
Agree.
Senator Durbin.